This is a video about the EDUQAS Medicine Through Time paper, and we're only going to focus on content for this video. We're not going to look at exam questions. What I'm going to do is I'm going to take you through the subtopics, starting with causes of illness, then how you would prevent yourselves from catching an illness, then how you would cure yourself. Then we're going to look at patient care and public health. What I'm going to do is I'm going to look at the 4 time periods for each of those subtopics, so medieval, early modern, industrial and 20th century. You can use this to help you revise in terms of watching the video for the key information being put up on each slide. You can also listen as I add key bits of extra information. You can also use this video alongside your knowledge organiser. So with all of those together, you should be creating some really good revision cards or revision pages, or just listening to this and watching it multiple times in order to get that information. Okay, so let's start with causes of illness in the medieval era. So I've put up some key bullet points there of things that are causing illness at this time. So poverty and living conditions are the main thing. Now, most people are living in poverty in the medieval era. Most people are farmers or have jobs that don't pay much, and therefore they're not able to live in good housing or good living conditions in general. On top of this, you've got dirty living conditions in general in the street. So whether you lived rurally in the countryside or whether you lived in a town, there would be some dirt around because they don't understand about hygiene and the fact that it's poor hygiene and dirt and germs that are causing illness. So especially in towns and cities, you've got waste in the street, human and animal waste. It goes into the river as well, and that causes the river to become polluted, and people are using the river to wash and clean themselves as well as sometimes drink. So all of this is going to lead to illnesses that we know, such as cholera and typhoid, that are caused by dirty drinking water. But obviously they don't know this at the time. On top of that, especially in towns and cities, you've got crowded living spaces where people are living on top of one another, and that means that all these illnesses that they're picking up quite easily are also spreading quite easily through contact. Famine is something that's often left out in the medieval era in terms of causes. As I said, most people are relying on the land to feed themselves and to work. If there has been a poor harvest, so if there has been too much rain or not enough rain, then that means that crops won't have grown as well. That also means that price of food will go up because there's less of it. So those that are living in poverty can't afford food. There's not enough to go round. This will lead to starvation, which is an illness in itself. But also, if your body has not had the right nutrition through lack of diet, that means it's going to pick up illnesses easier than it would have before because the body is weakened. Warfare is another thing that is causing illness. In the medieval era, it's a very conflicted time and people are at war quite a lot. One of the common things that you would experience possibly is siege warfare, which didn't really involve much fighting. It involved taking a town or city or castle by siege, which meant to surround it and wait for the people inside to be starved out. That would also lead to famine. On top of that, you've got troops who are going from city to city and town to town. They are en masse, they are lack of hygiene as well, so their illnesses are spreading much quickly between them, such as cholera and typhoid again. On top of that, you have got warfare itself, so you've got injuries and infection from things like spears and swords. It's important to note that many people believed that it was bad spirits or the supernatural that are causing them to become ill because they don't understand germs, they don't understand science, so they would rely on something that seems to be bigger and more powerful than they are. So God would be the main thing, being as religion was very important in their lives at this time. The church controlled much of people's lives and the way that they thought. So many thought that they were ill because God was punishing them for not living a good life. Another thing that they believed was that miasma, which is the theory of bad air or bad smells, that is causing you to become ill. Evil spirits is also linked to the supernatural, so bad luck could be the reason why you're experiencing ill health. And a really important one is the theory of the 4 humours, which has been around since the time of ancient Greece. Hippocrates came up with this through careful observation of people who were ill, and he observed that every time you were ill, there was a particular liquid that was coming out of your body, So for example, if you had a cold, a lot of phlegm was coming out of your body. If you had a wound, a lot of blood was coming out of your body. If you were ill, a lot of waste was coming out of your body. And so he put these humours or liquids into 4 categories: blood, yellow bile, black bile and phlegm. And it was believed that if one of these was out of balance, that was causing you to become ill. There was too much of it in your body and it was trying to get out. So people are believing in these because they don't understand science and the theory of germs. So it's important to know what they believed and what was actually causing illness. Then by the time we get to the early modern era, very little has changed in terms of these 2 time periods because there have been no advancements in science and understanding. So people are still believing in the same things that they believed in before, and as a result, living conditions aren't changing, so poverty and dirt are still causing poor health. The only thing that's really changed in these 2 time periods is warfare, less reliant on siege warfare now. There are new weapons such as gunpowder and cannons, and this is leading to new wounds and injuries. So if you're thinking about gunpowder and explosions and shrapnel, you're thinking that the injuries are bigger and wider spread and cause more internal injuries as well. So those are the only things that are really changing in between those 2 time periods. In the industrial era, living conditions are causing illness again, but it's slightly different than in the medieval and early modern because of what has changed since those time periods. So yes, we still have overcrowding and we still have dirt, but it looks slightly different in this time period. Because technology has moved on, people are moving away from villages and they're moving towards towns and cities because farming has become more private. Therefore, people can't afford to sort of close off their own fields and start their own farms. Factories are being built into towns and cities at a rapid pace, so people are moving to the towns and cities to get work. People are taking advantage of this in terms of the housing. So many people are desperate to come to the towns and cities, they'll put them anywhere in terms of houses, and they are literally living one on top of the other. This type of terraced back-to-back housing was given the nickname slum housing because of it was cramped and because of the poor conditions inside. So outside you're talking about the streets and the fact that there is waste in the streets. Most people are sharing one toilet between 50 people. The pollution is causing the streets to be dirty as well. Inside, the houses were damp, dirty and overcrowded. So if you lived in a cellar dwelling, you were experiencing very little natural sunlight and a lot of damp because there was no sort of quality of housing at this time. Lots of children experienced illness called rickets, which is caused when your bones aren't growing properly because you have lack of natural sunlight and lack of calcium. So poor diets and poor living conditions are causing a lot of illnesses. The fact that they're overcrowded, again, means that diseases are spreading quicker. Most people are living in poverty when they get to these towns and cities. So like I said, they're not able to afford proper housing, proper diets. Because they're so desperate for money, a lot of the children are going out and working in dangerous jobs like chimney sweeps and in coal mines. All of this together, the living conditions, the poverty and the jobs, means that in towns and cities the average life expectancy was 15 years old, which is one of those shocking facts that could be quite easy to remember as a detailed fact. On top of that, if you went outside, you've got the pollution from the factories filling the air. This means that there's going to be a lot of lung illnesses around at this time. So pollution is causing things like pneumonia. Accidental death in the workplace was very common because these jobs are quite dangerous and there's no health and safety. So for example, in that picture down at the bottom corner, you can see that there's lots of hot iron and coal in that area and heavy machinery. There's lots of stories of people's hands getting caught in machines and skin and muscle being ripped from the bone. On the other side, you can see that there was a job about making matchsticks. And these match girls, as they were called, were breathing in the phosphorus fumes. It was making their skin yellow and it was rotting away part of their jaw and their mouth. And this was called phossy jaw. So you've got lots of different illnesses being caused by the types of jobs that people had. Also, it's worth noting that this was a time where the British Empire was at its height. So these new diseases from different countries were starting to appear. They were called tropical diseases or tropical fever, but it's most likely they were diseases such as malaria now. So going to these countries such as India and Africa was causing new illnesses that they'd never seen before. You'd think that we had advanced and there would be less causes of illness as science and technology took over and we became more educated. But actually, the 20th century was dominated by warfare. We have 2 big world wars at this time. The technology actually is a hindrance because it leads to wider, more injuries. And also, we see physical injuries such as shrapnel wounds, but also mental illnesses such as shell shock, so things that can't physically be seen straight away. Technology is also causing illnesses as well as trying to help treat them. So using screens from televisions and computers is leading to eye problems. More cars on the road means there's more traffic accidents and pollution. And also it's less what is causing illness in the medieval that they couldn't prevent. This time we're choosing things in our lives that are leading to more illnesses. So diet is a very common one. In the 20th century, there's more access to fast food, which doesn't have as good nutritional content as things that are homemade. So by choosing to eat fatty foods, sugary foods, this is leading to illnesses such as diabetes. Also lifestyles in terms of the freedom that society has given people in the 20th century. There's a lot more sexual freedom, for example. And drug use is leading to new illnesses that hadn't been seen before, such as HIV. So in terms of causes of illness, throughout time, I would say it changed in terms of things that you couldn't prevent because there was a lack of knowledge. And by the time we got to the knowledge in the 20th century, it was more of a choice that we were making. So we were choosing to use television screens and eating the wrong type of food. On to prevention. So how would you prevent? Which is very important to know the difference between preventing and curing. If you're preventing an illness, you don't want it to happen. You've heard there's an illness around you, you don't want to catch it. Curing it means you've already got it, so how do you get rid of it? Sometimes they can be quite similar though. Especially in the medieval and early modern, when there isn't really a very good knowledge of what's causing illness, so they're not really differentiating between prevention and cure. So in the medieval era, because they thought that the 4 humours were causing illness, they believed that a healthy person would have all 4 humours in balance. So to prevent yourself from getting ill, you had to keep them in that way. So a lot of people would go for regular bloodlettings, for example, because it was an easy way of making sure that your blood was at the right level. If you were poor, you would go to a barber surgeon and his tools wouldn't be very clean, and it would probably be worse for you to go and get that, so it probably cause more illnesses than it would prevent. If you were richer, you might have somebody come to you and do a regular bloodletting. And this could be done in a couple of ways. So you could have your veins cut, you could put leeches and they would suck the blood out, and that would be fairly safe because leeches are clean and they coagulate the blood, which means they kind of close it up and prevent you from taking too much blood, and they keep it clean. And you could have cupping as well, which is where you get hot cups and you place them on the body and they kind of create blood blisters and draw the blood out that way. Keeping evil spirits away would be quite a good way of preventing it if you believed that it was evil spirits causing the illness. So you would go to your soothsayer, local wise woman, and she would have charms, necklaces, bracelets, that type of thing that you believed had been blessed or had something about them that would keep away any bad spirits and therefore keep you healthy. Obviously religion is still very big, so praying, doing anything to be right with God, giving money to the church. Some people even went as far as flagellating themselves, which is to whip yourself, and they would do it very publicly in the street, almost parading down the street to show everybody how sorry they were. So if they showed God that they were a good person, he wouldn't give them an illness. Of course, the bloodletting and the flagellating is probably going to cause an illness, especially if you're parading through a crowded street that's got poor hygiene, whipping yourself so you've got open wounds on your back. It's probably going to lead to infection and a fever. And when we get to the early modern era, very little has changed because they're still believing in the same things. They're still preventing it in the same way. Industrial era then. They had a saying that was prevention is better than cure. Because science is starting to take a hold, experiments and observations are starting to happen. People are starting to think, well, wouldn't it be better if I kept a healthy lifestyle and kept myself healthy, and therefore I wouldn't get ill, and then I wouldn't need to bother a doctor and pay for medicine and things like that. So prevention is better than cure became something that they focused on. So this led to things that were actually quite good at keeping you healthy. So they would change their diet and their lifestyle. For example, cut out meat and become a vegetarian, or cut out alcohol and become a teetotaler. These were things that would actually make you healthy as a person. They were obsessed with cold water, so one of the things that they would do would be to drink a glass of cold water in the morning to kind of flush out your system, which is a bit like a detox in a way, and that would actually be quite effective at keeping you healthy. Going for cold water baths, so you could have a plunge pool built into your back garden and you would dunk yourself in the plunge pool in the morning. Going to public baths, as you can see in the top corner there, became fashionable too. So you'd have hot bath, cold bath, that type of thing. And they would do something called like taking in the sea air. So if you read a lot of Jane Austen, you would notice they say that a lot. They go to Bath, or they go and take the sea air, or go into the sea. And you can see King George doing that in that picture there in Weymouth, which is by the sea. And actually, sea air and being close to the sea actually is quite good for you in terms of health. So some of these, they're not going to change your life, but they are going to keep you relatively healthy, especially compared to what they were using in the medieval era. But it is all about fads, and it is all about fashion in the Georgian and Victorian era. So they are doing it for the right reasons, but they're kind of doing it to sort of keep with the trend. Science is beginning to play a part in how you prevent yourselves from getting ill. So because we have scientists testing and observing their theories, they're starting to pinpoint what's causing illness, and therefore you can be quite effective in how you prevent yourself from catching it. So a good example of this is John Snow in London. During a cholera outbreak, he observed that in a certain area in Soho in London, people were catching cholera at a big, large rate. So he mapped the street and worked out that there was a certain area of Soho where the most cases of cholera were present. And then further away people got, the less cases of cholera there were. So he said there must be something causing cholera to spread at a large pace in that area. And he worked out there was a water pump that everybody was sharing from that place. Whereas in other places it was a different water pump. In one case they were by a brewery, so they weren't really drinking water at all. So that to him proved his theory that that particular water pump, there was something in it that was causing cholera, and when he turned it off, the cases of cholera went down. That later leads to the germ theory and helps people to realise that it's germs that are causing illness. Of course, they're not 100% sure on that at this point in time, but it's starting to show that there are certain things that are causing illness and we can do things to prevent it. So by shutting off that water, it was preventing cholera from spreading. Another good example of science being used to prevent illness is the work of Edward Jenner in creating what's considered to be the first vaccination, and it was the vaccination for the smallpox illness. Smallpox was a very feared and common illness at this time. You can see that lady in there, she's got the marks all over her skin. If you survived, which was unlikely if you would survive smallpox, you would have scarring. Some people would be left blind. So it was a really frightening illness. What Edward Jenner realised is there was an illness called cowpox, which is a bit like smallpox but in cows, and it would be passed on to humans, and it wouldn't really be deadly to humans. He noticed that anyone that had caught cowpox that then were around people that had smallpox very rarely caught it. So he worked out there must be something in the cowpox illness that would give you an immunity. It would make you immune to smallpox. So he went around experimenting, as most of the scientists did, and he managed to, with experimenting on a young boy, prove that if you had caught cowpox, you would then be immune to smallpox. And he went about creating the first smallpox vaccination, which you would take before even catching the illness, and it meant that you would never catch it. So in theory, it's the most effective method of prevention. Now, At this time period, it's only really the smallpox vaccination. In the century, vaccinations are the key method of prevention, so there are more vaccinations being created with other scientists. Things such as measles, mumps and rubella, which is known as MMR, flu vaccine, typhoid vaccine. These are being used during World War I to prevent soldiers from catching basic illnesses in the horrible living conditions that they're having to deal with. It's also becoming mandatory, which means that they're making people have these vaccines, especially at a young age, where you're more likely to catch and spread illnesses at school and things like that. It's important to know that vaccines are only really effective if the majority of the population have them. Now, there are a lot of side effects being reported to various illnesses, especially MMR jabs, so some people have become what we know as anti-vaxxers, which is where they don't want their children to have the vaccination because they think that with a healthy lifestyle, they can keep their child healthy that way and they won't be experiencing the side effects of these vaccinations. But it's because of vaccinations that, for example, smallpox no longer exists. It was eradicated in 1985. Vaccinations is a key method of prevention in the 20th century, but they also focus on infection. Now, infection can be cured, but it also can be prevented. It was a key cause of illness in the medieval and early modern era. If you got a wound, you could survive the wound, but later die of the infection that it led to, because it leads to a fever and it shuts the body down. So one of the things they're working on in the 20th century is explaining antibodies and germs and coming up with ways of preventing them from infecting wounds and therefore causing you to become ill. They also got a better understanding of the human body, and hygiene means that people aren't really becoming ill with things that can be easily solved. So all these illnesses that were caused from dirty water, dirty hands, people transferring germs that way, are things that are known about much more commonly in the 20th century, and it becomes something that's fairly normal, such as washing your hands when you go to the toilet or when you're preparing food or making sure you have a clean surface. These are all things that are compulsory now and common sense now and very effective in preventing illness. Let's move on to cures next then. So if you got an illness, how would you cure it in the medieval era? The key thing that you would be using is natural remedies. Herbs are everywhere. People would have a fairly good knowledge of herbs. They would have a herbal that was possibly passed down through their family, mainly written by the woman in the house, and she would have kept note of herbs, drawn pictures of them, given recipes on what you would do to create medicine from them. And also you could go to the soothsayer and she would have a good knowledge of herbs as well. Some key ones to remember is garlic is a very effective herb to treat infection and prevent infection. If you look on antibacterial wipes or anything like that in a first aid kit, you may sometimes still see garlic as an ingredient amongst all the chemicals, so it's still fairly effective. Lavender was a good one for pain relief because it calms people down, keeps the muscles from tensing. Or ginger used for nausea. Ginger settles a stomach quite well, and again you do still see it in sort of your Gaviscon and your medicines, your anti-sickness medicines like that. You will still see ginger being used. The four humours are still a believed cause, so they're used to prevent, but they're also used to cure. And again, you would go to the barber surgeon for some cutting or leeching. He could give you something nasty to drink so that you would be sick, and that would be called a purging to clean out the black bile. And star signs are being used to treat illnesses. So it was believed that each star sign was connected to a different part of the body. So what a physician or a doctor would usually do if you went to him with an illness is they would ask you your star sign and they would draw up your star chart using the sky. And that would help them to figure out if you were a Leo, for example, or if the stars were in a certain position the month that you came to see the doctor, they would work out that it's your head or your liver or your leg that was causing the illness, and therefore they could go about with a specific treatment. And obviously, praying is still being used, praying to God, asking him to cure you. And as before, very little changes between the medieval and the early modern era. The pattern that we are noticing is that science is playing a part in medicine. Surgery is the focus in the industrial era. People start to develop ways of cutting into the human body in order to make it better. The problem is that in the industrial era, surgery is a very public, dirty thing. So you can see in that picture there's like a gallery for viewing. You can't see it, but the surgeons wouldn't really be wearing much protective clothing. They'd be going from patient to patient wearing the same clothes, not washing their hands, not washing the tools or sterilising anything. It'd be incredibly dangerous. On top of that, you've got no painkillers. So these patients are being performed on when they're awake and they can feel everything. One of the problems was they would thrash about in pain, and that would mean that the surgeon would miss key bits and wouldn't really have the time to be thorough. Also, a lot of people would just die from the shock and the pain and the blood loss. So when James Simpson experiments with chloroform and works out the right dosage to knock a patient out unconscious so they couldn't feel the pain, it meant that surgery could become more accurate, surgeons could take time, and that helped surgery develop and meant that it was actually quite an effective cure depending on the illness. Joseph Lister is another key figure helping with surgery in the industrial era. He helped develop carbolic acid, which was a spray that you could spray on a wound, on bandages, on tools, on hands. Also, they were sprayed just in general in the hospital wards to make sure that the air was sterile, and that meant that there were no infections being picked up, or at least not as many as before. He also made sure that the surgeons were wearing protective equipment. You can't really see in that image there. So this means that surgery is more precise, you're less likely to die after the surgery from infection, so surgery is being used to cure illness. Don't forget that there's still some herbs being used at this time as well, especially as the poor couldn't afford to go to hospitals. And as we've said, herbs can be fairly effective. Technology is also obviously taking a huge role in how they cure illness. Because of the work of the surgeons in the industrial era, there are new types of surgery by the time we get to the 20th century. So for example, blood transfusion is being used, organ transplants are being used to cure people who have liver disease, heart problems for example. Alexander Fleming's discovery of penicillin in the 20th century was also being used to kill bacteria. This resulted in effective cure for multiple illnesses. Lots of different illnesses can be cured using penicillin. Radiation is also being developed thanks to the work of Marie Curie, who develops the X-ray, but also she discovers radioactive elements like polonium. This is later used to kill cancer cells. So one of the things they would do in chemotherapy is you would have radiation therapy, which is where you target those cancer cells and kill them off. Cures are more specific in the 20th century and therefore they are more effective. In the 20th century, you've also got alternative cures being used, so people are moving away from science and more towards natural remedies, and some of these are very old, such as acupuncture, which is a ancient Chinese remedy, where you put needles on pressure points in the body, and each pressure point is connected to a different part of the body. So it can relieve multiple things like back pain to heart spasms. Yoga meditation are also being used. It's on positivity, so lots of cancer patients, for example, will use meditation and yoga to kind of stimulate positive healing in the body. Now, it's important to know that patient care is different to cure. You want to think about caring for patients as where would you go if you were ill and how would you be looked after. Now, a tiny part of that is the cure, but please do not make the focus of your answer cure. It should be a brief mention. It's mainly about where would you go, what care would you receive in terms of nursing and beds and food and that type of thing. So in the medieval era, because religion is so ingrained in people's lives, the church would be the people that you would go to if you were ill. They were in charge of caring for the sick. So you would go to a monastery possibly, which is a very, very large church, or an abbey, and there would usually be an area in there. So for example, they would have an infirmary, be like a room or a section or a corridor where they would focus on looking after the sick there. So if you were ill, that's where you would go. Now, the focus of their care wasn't on curing, it was how would they look after that person, how would they prepare them for death, basically. So it wasn't really about the body, it was about the soul. So that would involve things like praying for them, giving them a chance to repent their sins. So most of these infirmaries would have beds, so you would have a bed and you would have a warm bed and a warm meal, and that would make you feel better, but it wouldn't really cure you. And really there would be a chapel or a place to pray at the end, so you wouldn't have to walk very far, and you would have monks and nuns there praying for you and you could confess your sins. So it was that type of environment. They would possibly be using herbs and things like that, but other than that, because monks and nuns did have some medical knowledge because they were the people that could read and write, but again, not a lot of medicine, not a lot of curing going on. They would also have, in a way, specialist hospitals. So an almshouse would be kind of their version of a care home. So if you were poor or old, you would go to an almshouse and they would again give you the exact same care, warm bed, meal, access to prayer. But other than that, not anything going on. They would have leper hospitals, which would specialise in looking after lepers, which was like a skin disease, very contagious skin disease that would rot away the flesh, basically. So that was very contagious. They would be on the outskirts of towns and cities, so they would be, being kept away from people. So you can see it in that image there, that person is physically being kept away from the population. And the church took care of that because they believed that, to be a good person, you had to look after those less fortunate. So that's why they were specialising and able to give people somewhere, whether you were pregnant or old or poor or ill, they would give you a place to stay. Modern era, it actually does, it's the first time things start to change massively, because Henry VIII dissolves the monasteries, which means to shut them down, when he changes the religion of the country from Catholic to Protestant. He goes through and tears down monasteries and takes the Catholic riches that were associated with the Catholic Church. So a lot of these monasteries that had infirmaries and offered care for the sick and the old and the poor didn't exist. So the church stopped providing real care for patients. This meant that it was up to local towns and cities to create hospitals and find a way of funding them. So a lot of them were funded through donations, often by rich people, sometimes by taxing the public, and even at times by the crown itself. So there's an example of Edward VI, who was Henry VIII's son, giving money to a hospital in London so that they could provide for the care for the sick and the poor. And that's really significant because it's the first time the monarch is taking a part in looking after the health and well-being of their people. This meant that because there was money and because it wasn't the church, it was individuals caring for patients, that there was some improvement in the quality of care. So it's the same in terms of bed and a hot meal and keeping clean, but it was also sometimes some hospitals would have access to barber surgeons, or there would be herbs used. But again, because it's the early modern era and there isn't actually much medicine available, there is little care taking place. Industrial era, as usual, is where the most significant change takes place. We have hospitals called endowed hospitals being set up, and they are privately funded hospitals, so they're the first real example of private hospitals. They were usually funded, again, by individuals, usually rich factory owners called industrialists, who had the idea that if they gave money to set up hospitals in the local area, then their workers would go and experience a decent quality of patient care, and therefore they won't have workers slacking off or not working to their best ability because they're ill. So they thought that it was a bit like an investment. Science is taking a bigger role in people's lives, so that's obviously affecting the quality of care that patients are receiving. Again, because they're realising what's causing illness, they can come up with more specific ways of caring for patients. For example, actual medicine, actual treatments, surgery. All this comes under patient care, but it's not the only part of patient care. A big part of patient care is the quality of nursing and the actual hospitals. So Florence Nightingale has a really big role to play here. she introduces something called the pavilion system, which you can see in that picture there. It was basically the ward system that we're used to today, where you would have one long corridor, and in that corridor you would branch off into 6 wards possibly. Each ward would have about 6 beds between them. Because they're branching off from the corridor, it means they have some peace and quiet. It means that fresh air is being allowed to circulate. She made sure that there were windows with the light and the fresh air could come through. And the hospitals themselves were much cleaner than before, and that's due, we can link to advancements such as Joseph Lister's carbolic acid, for example. She did this because of her work in the Crimea War, where she went to military hospitals where they were filthy, they were claustrophobic, there was no fresh air, and she took some nurses there and she kind of trained them into becoming more efficient and to making sure that hospitals were cleaner. And because of simple changes like that, like creating fresh air and clean space, death rates plummeted dramatically. So she proved that her work was effective, and it was starting to be introduced into hospitals in England when she returned. Another thing that she did was, because she brought those nurses with her, she opened up a school of nursing when she came home, and she believed that nursing could be better learnt on the job, being practical rather than just theory, so just studying. So she made sure that her school of nursing, that the nurses were actually on these wards practicing medicine. Because the nurses were better trained than they ever had been, that meant that it was a proper profession now, and nurses were actually involved in caring for the patients, not just cleaning them, not just making sure they had a tidy bed, but actually administering medicine, giving the doctor advice on the best course of action. All of this was improving the standard of patient care for patients dramatically, but you did still have a gap between what care the rich received and what care the poor was able to afford. Now, caring for patients changes dramatically in the 20th century with the creation of the welfare state, which is a state that cares for the welfare of its people, and they do that in various ways, such as giving benefits to the unemployed and the sick, giving free education to the children, and most importantly, providing free healthcare. With the Healthcare Act of 1946, we have the NHS being created in 1948. NHS stands for National Health Service. It provided free healthcare for all people in England, and that was incredibly effective because it was the first time that anybody could go to a doctor's, to a dentist, to an optician's and receive good quality of care and did not have to pay any money for it. So this comes under all different types of areas. We've got midwifery, so you've got maternity homes that you could get access to. Anybody who watches Call the Midwife, it's quite a good example, because not only do they have a maternity home, they go on to home visits and it's all free, and they also set up in local community centres vaccination clinics and midwifery clinics. And all of these are things that you can go to for free. So people were getting injections for free, they were getting health advice for free, they were getting care during childbirth for free. All of this is going to cause death rates to fall. All of this is going to improve the quality of life for everybody. So you've got stories of people who would never have been able to afford things like glasses before, being able to go to an optician's and receive a pair of glasses for free, or being able to make sure the quality of their teeth was good because they could go to a dentist. So all of this is going to be better quality of care using better equipment, and most importantly, it would be free. So this is one of the biggest changes in medicine, not just in patient care, throughout all of the full-time periods. Now we're going to move on to public health as the last subtopic. Now, public health literally means the health of the public, and that can come under multiple kind of subheadings. What most people do is they just say public health is what's causing illness over time. It's not necessarily the only thing that's part of public health. So I want you to think about public health as being things like living conditions, quality of air, quality of the streets, people's attitude to public health, what do they think about keeping clean, and also what the government is doing about it. So in the medieval era, public health isn't very good because they have a poor attitude to it. People don't know about hygiene, people don't really care about keeping their houses clean and the streets clean. So you've literally got waste running through the streets, you've got open sewers, you've got houses close together, and people are drinking and dirty water and not bathing properly and things like that. So public health isn't very good. So you would assume that nobody's really doing anything about it because attitudes are very poor. But you have got small case studies of some towns and cities doing something about it. So Coventry is a very good case study. The mayor in Coventry made everybody clean their street or face a fine. So you would have to sort of sweep the step and the kind of area around your house. So if everybody did that, they thought that they would keep most of the town and city quite clean. They had a man come to collect waste every week, and he would be paid to collect that waste and take it far away from the city. So it's kind of like the first version of a bin man. Waste must be left outside city limits, so they had about 7 areas that were far away from rivers and far away from populated areas where you would have to go and put your waste. It was hard to keep it going, you know, not all towns did it and most people ignored these rules, but it did show that people were starting to make the connections and were starting to say, look, if we're all going to live together, how are we going to try and live healthily? But because people didn't really believe in being clean, it wasn't very easy to maintain these rules. In the early modern era then, changes happening, not so much in terms of quality of living and attitudes. There's still open sewers, there are still animals in the streets, and people still really are making the connection between germs and dirt and your health, as you can see by that wonderful drawing of people literally throwing their waste onto people's heads. But the government is starting to do something about it. So it's not so much the government, but it's actually the monarchs that are starting to do something about it. If the monarchs are doing something about it, it's kind of like the law, and it's kind of forcing people to obey it. So Henry VIII enacts a law to make cities build sewers so that the waste isn't going over the streets and through the streets, it's running underneath the streets. He also wanted slaughterhouses to be built away from towns and cities as well, so there wasn't animal waste flowing through the streets too. The Fire of London in 1666 meant that a lot of London had been destroyed, so they used it to their advantage and they used it to build up London better than it was before, so better quality materials for housing and streets, so stone and cobbles, wide streets, clean streets, better housing, and this was going to improve the health of the public as well. People did start to make the connection at this time, not huge strides. So for example, we've got 2 women named Elizabeth. There's good case studies of this. We've got Elizabeth I, who was one of the queens during this era, and she would bathe once a month. So it's not great, but it's better than nothing. And then we've got Elizabeth Pepys, who was Samuel Pepys's wife. Samuel Pepys is famous for writing a diary that recorded the Black Death and the Great Plague and the Great Fire of London. So we know these things that happened because he wrote about them. He also wrote in his diary that his wife Elizabeth Pepys wouldn't let him into the marriage bed unless he had cleaned himself and he'd had a wash. So 2 women making the connection between being healthy and being clean. Era, we would kind of say public health is at an all-time low in terms of they've got the knowledge, but they're really not doing anything about it. Living conditions are still poor. Diets are poor. There's a big gap between the rich and the poor. Pollution is worse than it was in the medieval and early modern because of coal burning factories, and work is more dangerous than it's ever been before. All of this is causing the health of the public to be very, 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 very low, as you can see in the cartoons there, showing that literally death was prowling the streets. The government does start to do something about it though, and attitudes do start to change. Look at the bottom bullet point there. It's a good example of the 2 different attitudes. We've got the Clean Party forming, which are a group of people who believed that if you improved the health and the living conditions of the poor, then you would improve their health. And then that would benefit us all in the long term because we wouldn't be using money to care for the sick. So they thought that we should start improving living conditions and that would improve public health. On the opposite side, you have the Dirty Party, who were made up of MPs and rich people who didn't want to spend money improving the slum houses, for example. It's not they didn't believe that illness was caused by poor living conditions, they just didn't believe in doing anything about it and spending the money on that type of thing. So we had these two different groups forming. But in the end, the government does do something about it. They pass a number of acts, the most famous being the Public Health Act of 1872, which was the second Public Health Act, but it was the first one that forced people to improve the quality of living conditions, making sure the streets were clean, making sure houses were built better, making sure there were actual rules in terms of what food was given out, what medicine was given out. And that created more jobs. For example, there was a specific job which you would go around inspecting living conditions in houses, and if it wasn't up to scratch, you'd have to force the landowner to do something about it. All of this is going to improve the health of the public, but more importantly, it's showing that people's attitudes are changing and the government is getting involved in improving the health of the public by law. Public health in the 20th century experiences a very large change because of the Beveridge Report, which was a report where they gathered information on the living conditions of people in England, and they identified that there were 5 giants, which are 5 problems that people were facing to do with their health. These were idleness, ignorance, want, squalor, and disease, which basically translate to lack of education, disease, and poverty. What they did is they passed a series of acts that were then going to improve the living conditions of people's lives. These were things like getting rid of the slums housing, better quality inside of houses like private showers and toilets and things like that, and running water. Now, we have many acts like the National Health Act of 1946 that deals with these, and the Free Education Act and Free School Meals Act and things like that. They all go to improve the health of the public, and they are listed on your knowledge organiser. So the government was doing things to try and improve the health of the public. They were building council houses as well. You can see a picture at the bottom there. They were spaced apart. They were semi-detached houses. They were no longer back-to-back slums. You have big streets, front and back gardens, private toilets, modern conveniences like running water and heating. All of this is going to improve the living conditions dramatically and therefore improve public health. If you go to the later half of the 20th century, we've got the Clean Air Act being endorsed, where they realised that they needed to do something to improve the quality of air. So there was a large smog incident in the 50s in London where a cyclone trapped smog from coal and factories for a number of days in London, and they worked out that altogether it killed about 12,000 people. So that was a serious problem, and obviously later on in the 20th century we've got climate change being recognised a lot more. So they passed the Clean Air Act in order to make sure that factories and car emissions, they weren't producing as many as before, and that improves air quality. We've also got diet being included in the health of the public. They realised that in the 20th century diet is very poor due to fast food and sugar. So they come up with the 5-a-day campaign, which is the government encouraging people to take exercise and eat 5 fruit and veg a day. They also have to label food now for its content of fat and sugar and calories and so on. And that's law in order to give people a good choice so that they can make the right choices in terms of improving their own health. So again, the government is getting involved in lots of different ways in trying to improve the health of the public. Okay, so now we need to kind of summarise what has changed in terms of health and medicine over those 4 time periods. Very little changes from the medieval era to the early modern. This was due to the church having tight restrictions on people's lives and a lack of scientific advancements. But we have got the Renaissance era that takes place during the early modern, and in this era you do make huge strides as people began to experiment more with treatments and investigating the human body. So we have people like Andreas Vesalius, who starts to look inside and dissect human bodies and figure out how the human body works. So we have a more accurate understanding of causes and ways of treating illness. But a lot of these things don't really take place until you've got the science to back it up, the medicine to kind of go with it, which takes place, in the industrial era. So we've got the beginning of change in the early modern, but we don't really see that change until the 2 time periods after. The industrial era was the age of science. We've got many new medicines being created, and we've also got the government actually taking part in helping improve the health of the public, so they're not ignoring it anymore. And in the 20th century, there are new causes of illness, but the welfare state means that all citizens' health is cared for by the government, and we've got the term cradle to the grave, people being looked after from when they were born all the way to when they died. And all of this is using modern technology and key scientific breakthroughs. So you must make sure that as well as revising content that you have talked about what changes and what doesn't change the same through time. What are the patterns? So we should be moving from the religious to the scientific to the 20th century where we've got equality and care for all of the citizens. Hope that helps. Hope you stuck through the whole 49 minutes. Happy revising.